Hey, I show 7 o'clock on my computer, so we will go ahead and get started. And I didn't say it out loud, but I did press the record button. So we are recording this, so it will be posted to CCR&R's YouTube channel probably tomorrow. So if you have other friends that are child care providers that you want to share the information that you get tonight, we'll have that recording available. Usually it's the next day. So thank you all for joining. I'm Brenda Loop. I'm the data specialist, and there's a few people still joining us. So I've let everybody in the room so far that's here. And if this goes like our afternoon session did today, you're going to have lots of questions, and Heidi has lots of information to share with us. So we're glad once again to have Heidi joining us from Healthy Childcare Iowa, and I will turn it over to her.
Well, thank you so much, Brenda, and thank you to all of you for allowing me to present tonight. We do have quite a few slides to go over, but if you have a question, just put them in the chat box, or and then Brenda will kind of stop me, and we can at least address those as we're going through the slide presentation. So I hope you're having a great evening, and I just want to thank you again for allowing me to be on tonight. I'm going to go ahead and share my screen, and we will start. I have a little PowerPoint presentation, so hopefully if everybody can see my screen, maybe give me a thumbs up to make sure that we're where we need to be. Okay, great. So just wanted to introduce myself real quick. For those of you who don't know me, I am a child care nurse consultant. My name is Heidi Hotvedt, and I'm the coordinator for Healthy Childcare Iowa at the Iowa Department of Public Health. And I'm just honored to be able to represent the child care nurse consultant group tonight, and also to share with you some of the guidance documents and information from the Centers for Disease Control, Iowa Department of Public Health, and from the Department of Human Services. This is an ever-changing situation, and I think what my word for, actually this came up a little while ago, and I was like, what do I feel like we need to know about the COVID-19 situation? And really where it comes down to is the importance of being flexible. Unfortunately, we don't have all the answers. This is new, and it seems like we're constantly having to kind of regroup, change our guidance, present something in a little different way. I try not to get too frustrated, but there's times where I will literally send an email out answering a question based on the current guidance, and then within a short period of time, maybe even in the next hour, a new guidance document will get posted, or new guidance will come out, and then what I just sent in the email doesn't apply anymore or has changed. And I'd say in the beginning of this, way back in probably February, March, that really bothered me. I've just decided I need to be flexible, and this is an ever-changing situation, and I'm just providing the guidance that I know for the time that I'm providing it. And I know you all understand that, because you are all very flexible, because you're childcare providers. You have your home-based business, and you know that things don't always work and are not always just exactly the way you had planned it for the day. And we just need to be flexible and understand that that we're all working very hard to provide the best guidance we can when you have questions and concerns. So just wanted to say thank you all for all that you're doing, because it's such important work. And also just I'm in a kind of a cohort group of other coordinators from different states, and I'll just say I'm really proud of Iowa, because we have maintained our childcare businesses throughout this pandemic, and I cannot say the same for most states. A lot of states have had to shut down childcare, completely shut down, and not have any childcare open, and that has been very challenging for those states, and it really has affected a lot of businesses that maybe will never reopen. And that's really one thing that I feel like Iowa has really worked hard to collaborate between our CCR&R agencies, our DHS licensing and registration consultants, DHS at the home office, and then also Iowa Department of Public Health to try to work together so we can provide the guidance that you need. So I'm going to go ahead and start. I'm going to actually, the first thing I'm going to cover is about isolation guidance. And the reason I had this slide first, I kind of was trying to figure out where to put our slides in order. But I'll tell you, I have had so many people contact me that with questions that because they've had a staff or themselves or a child in their care that have tested positive with COVID-19. I think we're having a lot more positive cases. We're doing a lot more testing, so that, I mean, I think we're finding more cases. And so this question consistently comes up is, what do you do when you get that positive case? So this right off the bat is, you know, if you think or know that you have tested positive, or the staff person has tested positive, or the child has tested positive, then and you have symptoms. So it's not just a positive, but asymptomatic, but you actually have symptoms. The CDC has an isolation rule that we are following. And I will tell you, this was just updated probably about a week ago. Actually a little bit more than a week ago, I had found out from the CDC that they were going to change their guidance a little bit. But I think it's really important for you to know that still the guidance is that at least 10 days, that your isolation is for the 10 days since the symptoms first appeared. So that's probably the overall arching. And I know that's really challenging for families and for providers, but we need to make sure that at least 10 days has transpired since the symptoms first appeared. And then this little 24 to 72 hours is probably the hiccup in the whole guidance, is that our current guidance from Department of Human Services and Iowa Department of Public Health is that at least 72 hours fever-free without fever-reducing medicine needs to have occurred. And the CDC changed that to 24 hours. And so we used to call it kind of the 10 and 3 rule. And now it's the 10 and 1 rule. And I will just tell you that for best practice purposes, it's your policy in terms of following, you know, your exclusion guidance for having children or staff out of, if you have a co-staff person out of care. But I really, to be honest with you, the 24 to 72 hours fever-free really doesn't bother me that they've changed that, because really the important part of that is that 10 days have passed and that symptoms have improved. Those are probably going to be more important to focus on than if they've are still running a fever. I would say if they're still running a fever for 10 days, that child is probably very sick and is not going to be in care anytime shortly. So focusing on the 10 days is probably the important part, and then the symptoms have improved. So that's if a child or a co-staff or yourself have tested positive. And I did see a little hand come up. So was there a question real quick? Lisa put her hand up.
Yeah, hi. Just a quick question.
Sure.
I wanted to clarify, is this slide, is there going to be a slide for someone who thinks or know they've tested positive, but they've not had symptoms?
Yeah, that's the next slide I'll be getting to.
Gotcha.
We'll talk about that. Yep,
Right, gotcha.
Good question. No, that's fine. So anyway, just so you know that currently our guidance is the 10 days, 10 and 3 rule, which is 10 days since symptoms have first appeared, that they need to have gone through that period, 72 hours fever-free without fever-reducing medication, and that symptoms have improved. But be aware that I think that guidance will probably be changing, and we probably will be going to what the CDC guidance says, which is 24 hours. So just so you're aware of that. So then this is that next scenario that Lisa just was asking. So great question, went right into my slide, is what do you do when the person has tested positive for COVID-19 but has no symptoms? And so the CDC really looks at that and says, okay, if you continue to have no symptoms, and that's what's kind of interesting, is sometimes you'll test positive and maybe not have any symptoms, or you don't think the person has symptoms, but then maybe 2 days later they start having symptoms. So really the CDC is saying if you continue through the whole time that you haven't had symptoms, it needs to be 10 days that have passed since the test. Okay, so if the test was done and then it's been 10 days and the test was positive and it's been 10 days, then they could return to care. And then there might be healthcare providers out there that, so I'm kind of putting this as a caveat, depending on the healthcare provider's advice and availability of testing, they actually might have retesting done to see if they'll get a negative. So just so you're aware of that, that has happened. I know for some providers, but I would say with Test Iowa, they would pretty much just, they'd do the one test. If it was positive, they would be positive. And then they would recommend that they wouldn't they would stay in isolation, self-isolation for 10 days at the minimum. And then if, of course, if any positive, if the person's positive and they start to develop symptoms, then you go back to the positive test with symptoms information. And this is, all this guidance is on the Centers for Disease Control website. And I'm gonna share with you kind of at the end of the presentation where some of these links are, because we're trying to keep everything linked on the Healthy Childcare Iowa website, so you can kind of go right to the page that has the information, or at least has some overall guidance on that information, because that has been very challenging, I know, for providers, for the general public, for the nurse consultants, for me, sometimes to find when you're trying to find information. And so we're trying to, every Monday, I really do a search to make sure that all of our website links are current, and that the information that we have on our Healthy Childcare Iowa website is linking to the correct information. So I would just say with having no symptoms, and I just want to just kind of put a little information on, we do know that we have had quite a bit of our percentages of children have had no symptoms or have had mild symptoms. And when we talk about symptoms, we talk about the whole gamut of symptoms that the COVID-19 symptom chart that's on the CDC website list. And I think that's because with children, it's very hard for a child to say, I've lost my sense of taste, or I can't smell like I used to. They just don't have that ability really to share that, or they might not say I have a sore throat. An adult would have a little bit more ability to identify symptoms that are more mild, where a child, I think, has a little bit more of a challenge, or would not be able to verbalize or really understand that they weren't feeling that great, or maybe that they were feeling fatigued, or that they weren't feeling quite well and their throat was hurting, where an adult would be able to recognize that symptom. So, fever is pretty, if they have a fever, it's kind of a no-brainer. We know that's a symptom, but we do know that children have been having a lot of mild symptoms. So just so you're aware of that. I'm going to keep going unless we get any either hand raise up or Brenda will jump in if we have some questions.
I do not see any additional questions right now, Heidi.
Great, thanks so much. So I do want to cover the case reporting and outbreak guidance. So that came out the end of June, and that there's a document on the DHS website that's called COVID Case Reporting and Outbreak Guidance. And it was actually a collaboration between Department of Human Services and Iowa Department of Public Health to make sure that we were all on the same page. And actually I had a question come up today about this. I'm going to just go back and share a little bit. Changing guidance has been a little bit challenging, because I had a provider actually a consultant and a provider reach out to me today, and they said, well, I thought we were supposed to call local public health. And, and that's what we were originally really encouraging providers, if there was a confirmed case or a concern about a case of COVID, that they should reach out to their local public health. And I'm not saying that you shouldn't see them as a resource, because they are, but what we were finding across the state is that that really our childcare nurse consultant and Healthy Childcare Iowa as a whole, we really understand childcare, and we look at childcare business practices and policies and guidance documents very, very unique to the childcare industry. And there's definitely some specific guidance related around childcare. And our local public health agencies may or may not have that same lens. So when this guidance document was created between Department of Human Services and Iowa Department of Public Health, it was shared with local public health to say, really, when there is a confirmed COVID case in childcare of a staff or child, and that's, I'm saying confirmed, so not I think they have COVID, but it's actually confirmed, then you as a childcare provider are going to reach out to your DHS home consultant. Okay, so that's kind of that first person, and then you're going to collaborate and work with DHS and collaborate with the local nurse consultant to help kind of walk you through what guidance, what you need to do. And that's on that that guidance document for case reporting. And then if there's 3 or more confirmed cases, and that would be 3 or more where they're not of the same household. So say there's 3 siblings that come down with COVID. We don't call that an outbreak. That's not considered an outbreak. But if it's 3 children from 3 different households, then we do have more of a concern that that's an outbreak occurring. And so if those are confirmed, then you would actually work, of course, with your DHS home consultant, but you would also be working with probably your local nurse consultant as well as me. So I'm actually tracking those for Department of Human Services and IDPH. We're kind of doing a tracking on how many cases and how many of those outbreaks have occurred across the state. I will tell you that in the last month, so I started collecting this data when this guidance document came out the end of June. And I think we're at, and I should have looked this up because I couldn't remember exactly where we're at, but I know we're less than 12. I think we're at 10 cases or 10 programs, homes and centers that have had 3 or more confirmed positive cases in staff or children in a 14-day period. So what we consider an outbreak. So we haven't had a lot. I to be honest with you, I was kind of concerned when we first started working on this guidance document, because the situation was, well, we need to track it. And then I thought, wow, how much am I going to be tracking? Is this going to be a lot of cases out there that we're going to be really working with for those outbreak situations? But surprisingly, we haven't had as many as I thought maybe we would have. I know we've had a lot of confirmed positive cases here and there, but it hasn't turned into outbreak status. And I will just tell you what that tells me is that we're doing a great job in childcare. You guys are doing a great job in your programs, because outbreaks really occur when there is, if you don't have good disinfecting practices, if you're not monitoring at the door with temperature checks, if you're doing some of those things that maybe are high risk situations with allowing a child to come back into care when they're ill, those kinds of things, then I think we would have had more outbreaks. Because what happens is then, an ill child's in care, or they haven't been monitored for a fever, then they actually do have a fever, or the parent has sent them with fever reducing medication, which I know occurs sometimes. And then the parent, then you accept them into care because you don't know that they've had a fever reducer, and then they have a fever after nap. So we know that happens. And I would just say we have done a great job, and you guys have done a great job with following the guidance documents, because I really think we would have had more outbreaks reported than we have. So kudos to you. Great job. I'm really pleased about that. And then, like I said, it's just the collaboration with the local nurse consultant, DHS consultant, and then also if it's an outbreak, myself getting involved so we can track that, because we're really wanting to provide that support to you. So when that initial positive case occurs, the first thing is, what do you need to do? And what you need to do is, you're going to reach out to DHS. You can simultaneously, you could do an email or a phone call to your local nurse consultant, but you're going to need to identify the close contacts of the positive case. And you look back, actually, you go back 48 hours. So say it's a child that's new to your care, and they come in on Wednesday, and you had some families that maybe were out for the week, or maybe you are category C, and maybe one of you was on vacation, so you had a low number of kids in care. So you're going to identify who's close contacts, and I actually am going to share a little bit about what close contacts are. I have a little slide on that, but you're going to see who are the close contacts, and close contacts are within 6 feet for 15 minutes, which we know in a home setting, that's going to be pretty much everybody, but not necessarily, because you might have some families that maybe weren't there, or weren't exposed to that child, or that child was just there on a Monday, and then there was maybe not as many children that day. Or some of the scenarios I've had is, the child was last there on Friday, but there was only 2 kids there on Friday. So it didn't really infect everybody, or didn't have a possible exposure to everyone. So we're just going to say, identify those close contacts. If that includes you, that includes you. And you're going to all need to quarantine for 14 days from the exposure. So when the last time that child exposed people or staff. And so you'll quarantine for 14 days. That may be a challenge for you as child development homes, because in a lot of situations that would probably involve you, and so you'll have to quarantine, and so you won't be able to provide care to the other kids because they'll also be quarantining. But every situation is so unique, and so I hate to just say that as too much of a blanket statement, because I've been on the phone with many child development home providers, and they're like, nope, it was my assistant who, she was only there on this day, and so she really only was around this group of kids, and that was my day off. And so so these are my close contacts. So I think just knowing that, you need to look at your calendar and look at who was there. And then I will tell you, the CDC has some great helpful quarantine scenarios, and they actually have calendars. So I put that link on there because I even have to pull those up. I mean, you have to look at the calendar to figure out the 14-day quarantine, because day 0 is the last exposure date. So sometimes that varies. And these are the kinds of situations. Well, one child was positive they were here on Monday, and then the second child was here not till Wednesday. And so what was my actual last day of exposure? So we usually look at those calendars, those scenarios, and actually pull up a calendar and figure it out for you. So we're here to help because that is a little bit of confusion, I know, sometimes for providers. And so I would just want to talk about that close contact definition. So that's anyone within 6 feet of the person who's tested positive and for 15 minutes or more. And it actually starts 48 hours before the person began feeling sick, because that's when they were infectious. So so that's how you kind of judge who that close contact is in that guidance document when you look at that case reporting and outbreak guidance. The other thing that's important is to make sure that you kind of have your roster or your child list, your list of who was there. So when you call the DHS consultant or your nurse consultant, it's really helpful to actually have those in front of you so we can walk through it with you if you need help. I think I saw something pop up. Did we have a question?
Yes.
Okay, great.
It says they're trying to write some policies related to COVID, and do you have recommendations? So are there any sample policies that providers can look at on the public health website?
Not really on the public health website, but definitely on the CDC website. And I would say reach out to your nurse consultant, because some of our guidance that we've had, and that's just be flexible because it might need to change. Okay. But I think if you're working on a policy, reach out to your local nurse consultant, because there's some great resources on the CDC website about policy development and procedures. So they could help you kind of walk through that. Any other questions?
Nope, that's it so far.
Okay, great. So the next thing I just want to talk about, and this is actually a slide that has been something that I've shared before, but I just want to go through it because I think it's still valid and it's really important for you to be referring back to that. So we really recommend that you go refer to this Centers for Disease Control guidance for child care programs that remain open. This guidance document has been updated, I think, twice since it's been out, but it really has been a helpful tool. And it's a helpful tool to the nurse consultants, as well as I know DHS refers to it. I know that CCR&R has referred to it, but it really spells out how do you keep your programs open? And that really is where some of those policies can kind of come from to help with how you're going to put a policy around some of these COVID specific recommendations. But some of the things I just wanted to highlight was the importance of the health checks and the temperature monitoring. And that is still something that is in the guidance document from the Department of Human Services as a must. It's not really optional. I have that question come up. Sometimes they'll say, well, are we still doing temperature checks and health checks? Because, some of those symptoms can be mild or children can be asymptomatic. But I'll go back to my previous statement of, I think the reason that we've done so well in our state is because we put a lot of those things in place right off the bat. And I do believe that it helps to do those health checks and temperature monitoring to prevent a child from being in care and exposing others. So that guidance document was updated. They have some scenario or some suggestions of how to do that temperature monitoring and health checks. And everybody's location, everybody has a different setup for their childcare business. So I would say reach out to your local nurse consultant, because a lot of times she, you know, if she hasn't already been on your site, you can work with her, maybe even by doing a virtual visit or an in-person visit. Some of our nurse consultants are starting to go back out in the field. So, and I know some of them are going off hours, so not going when you actually have kids in care, but going when you don't have kids in care, and can walk through kind of your layout to see how could you do temperature monitoring and health checks in a safe way for yourselves, using some kind of barrier method. And like I said, everybody's situation and their layout of their childcare business is different, but that really protecting yourself as you're doing those health checks and temperature monitoring is important, because then if the child, say the child was feverish coming to the door, and you did your health monitoring, your temperature monitoring and health check, and you didn't really have a barrier in place, then you would potentially have an exposure. And that could, you know, if the child tests positive tomorrow, that would put you out for 14 days. And so that's why I think following that guidance document and trying to use some kind of barrier method of temperature monitoring is really best practice. And I've heard some different ways of people doing it. I've heard everything from plexiglass to doing some kind of screen. I know of somebody who did a clear like shower curtain type thing, so they could have that in front of them, so that was preventing them from having that exposure. So different ways of doing things depending on your setup and your layout. So I'd say reach out to your nurse consultants, because I think we will be doing this for a while. I know the schools are looking at how they're going to do health checks and monitoring. So I really believe this is probably something we will do for a while. So if you haven't gotten a good system that you really like, or it's not working for you, reach out and see if you can make some changes to that. The next thing I just want to talk about is, this comes up a lot, but if you have a child that has a pending COVID test, so overall guidance for DHS is that if a child has a parent that's ill or has tested positive, of course that child is out for exclusion from your care for the period of time that they need to be out for that 14-day quarantine. But if they have a pending test themselves, and I'm put this on the slide because I'll tell you, this has come up. This question and this actually scenario has come up several times, where a child was pending a COVID test, but they didn't have any symptoms, and they were, you know, the whole family had gone and had testing done through the Test Iowa site, and then but no one was ill, and they didn't think anything was going to come back positive. But so they went ahead and allowed the child in care, even though the test was pending. And guess what? They were positive. So now we've just exposed everybody. So I would say if they have a pending COVID test, please exclude them. Or if they have, you know, any kind of illness, of course, DHS guidance says that a child with any illness needs to be out of care. They should not be in care if they are ill. We want healthy kids to be in care and not be potential exposure. So social distancing strategies, I don't think this is really something that necessarily most child development homes you know, have been able to consider, because we really say avoid mixing of groups, and it's really hard in a child development home setting to not have your kids all in the same location. However, I know of one particular child development home that I actually used to work with when I was a local nurse consultant, and I know they have an upstairs and a downstairs, and so they're grouping that way. They have one staff that they're a category C, and they have one staff that has their group upstairs and they're in ratio upstairs, and they have one staff person downstairs and their ratios downstairs. So I mean, they've really thought about how can we make this work so that we're trying to keep groups separate, so that if one group ends up exposed, at least the other group can still stay in care. So that I think we need to think, how can we think outside the box? I have in there about no floating staff. That really, I would say, relates more to a center than for a child development home. But there's a possibility that you could possibly have a floating staff that maybe you have a person that you're category C, and you have somebody that maybe just does the beginning of the day and the end of the day. And I would say, you know, maybe think about that differently if you could try to avoid mixing those groups. And then the last bullet on this is just the cleaning and disinfecting your facility when somebody's sick. And there's some definite specific guidelines. If you had a positive case in your child care, in your child development home, I would really encourage you to reach out to, of course, you're going to talk with your DHS person and your local nurse consultant, talk about what I need to do for cleaning and disinfecting. It's really important to do some ventilation by opening windows. Today was a perfect day. I opened all my house windows today because what a great day to air out the house. And we really want to get some good air movement and ventilation in to dissipate any virus spores or virus, I don't know if they're called spores. Anyway, any virus particles in the environment. If someone was tested positive, you're going to want to go ahead and clean and disinfect, but you do want to wait 24 hours to do that is the guidelines. Now, for a child development home, that might not work, because if it's your home environment, you're going to want to disinfect right away as soon as you hear about that. But just so you know, if you have a separate location in your home that's specific for your child care area, that you would want to just put a cloth face covering on, go in the room, open up windows to get some ventilation into that room, and then wait 24 hours before you go in and clean and disinfect. And then the CDC says if it's been more than 7 days, and this has happened. I've had a couple programs that'll say to me, oh, well, we just waited 7 days. We were going to be closed for 14. So we just waited 7 days before we did anything in that room, because what the CDC guidance says is if it's been more than 7 days, there's no additional cleaning, disinfecting needed because the virus would have dissipated by then. So I'm going to keep going because I don't see any raised hands or questions just yet. So I'm going to go into some kind of common questions that keep coming up, and just kind of want to give some, I don't have all the answers, but I do want to just provide some guidance and some things that maybe you might consider doing for some of these questions that have come up. So cloth face coverings, we do know that cloth face coverings are an added protection, a layer of protection from COVID-19. Our state has come up with recommendations. They're following the CDC guidance on that and recommending that people, when they can't be socially distanced from others, that they should have their cloth face covering. And I know a lot of schools, and I'm just going to be honest, I would say many or most, or possibly, I don't think we'll go to all, but maybe will be requiring face coverings in the school environment, depending on how they're going to do their back to learning and what their plan is. So, is this something that if you haven't started cloth face coverings in childcare, is this something that you would want to try to work on and start? I think it's doable. The CDC is still clear, no cloth face coverings for infants or toddlers. So if they're under age 2, they should not be having a cloth face covering. We know that cloth face coverings cannot be worn during meals or while they're napping. We have some of that information, but I would say that I think children are going to start seeing, if they aren't already wearing a cloth face covering out in public, they're going to see more and more adults and children wearing cloth face covering. So if you haven't started that and you're thinking about it, here's some things just to think about. Is this something that you would provide, or is this something the parents would provide? You're probably going to need to have 2 for the day, because I would say a lot of programs that have started it have gone with at least 2 during the day, because then they wear one in the morning, and then when they have lunch, they take it off and they eat, and then they put on a new one, after nap time. So would you provide those? Would that be something the parents would be responsible for? Who's going to launder them? I would say, that's really you know, up to you if you would want to launder them at the end of the day. If you are going to be laundering them and they're going to be all mixed together in a, you know, in a washing machine, you don't want to, you really want to encourage the same mask being worn by the same child every day. So use a permanent marker to mark them, whose is whose. It would be, I know some programs have said that that's what they've used and it's worked really well, you know, or they can be tagged, somehow tagged with the child's name on them. But definitely having them assigned to the individual child. We know that face coverings, some are smaller, some are bigger. The CDC and Iowa Department of Public Health actually has the links on the website in terms of, you know, how the face coverings are, you know, sewing instructions, patterns, how to make them. But I know for children, they need to be a little bit smaller. There's a lot of websites I know that are selling them also right now. So just something to think about. You know, the biggest thing, we want to make sure that, you know, children aren't touching the mask a lot, that they need to hand wash prior to putting the mask on or taking it off, and after they've taken it off. You know, definitely have some on hand in case a child gets ill in care, because it's good for them to put that on while they're waiting for their parent to come get them. So just some of those things to think about if you're considering cloth face coverings, you know, or if you already started them, but you haven't really thought about like the washing and all that. But there is a wealth of information on the, it's linked from the Iowa Department of Public Health website and the CDC on face coverings. So I would encourage you to reach out and look at those. Face shields, I know I've seen quite a few different face shields available on the market or people making them. And I just want to let you know that the CDC really does not have a recommendation for just wearing a face shield only. They really don't know if they're effective against the virus spread. Now, with a cloth face covering, that is helpful. But I do know some individuals had reached out to me and said, you know, well, we want to do a face shield because then at least the children can see our faces and can see our smile and can see, you know, what we're doing. And that's, you know, that might be giving a false sense of protection using the face shield without a face covering. So the guidance from CDC is that you would wear both if you're going to wear the face shield. And I also know that the CDC was very clear about if face shields are used, that they cannot be used on newborns and infants and that under age 2 group. It's just not a safe practice. So they have said no to having face shields for those, that they really don't have an option for them in terms of face coverings or face shields to be worn for that age group. I know that that if you chose to wear a face shield and you know I know there's some on the market that are made, so what the CDC recommends is if it's a face shield and you're not wearing a face covering underneath, that it needs to be the type that actually wraps around. And I've seen them there. I know in the hospital setting, it's almost like a whole like helmet, almost like system where the face shield goes completely wrapped around. I haven't seen those in the general public, but you know, they could come out, things change. So the CDC just says that, you know, if you're choosing to use a face shield, and you don't have a face covering underneath, they need to wrap around the sides of the face and extend way below the chin so that you don't have respiratory droplets coming around. So, so that's a little bit about that. Hand sanitizers with methanol. That was a Food and Drug Administration alert that came out. They've had some hand sanitizers that they tested and they actually had methanol, or they were actually labeled that they had methanol. Methanol is very toxic and can cause severe concerns for a child. So there's some information on that, and I actually posted that on the Healthy Child Care Iowa website, so you can read some more information on that, and you can actually sign up for alerts. But there's a whole list on the FDA recall list of different brands of the hand sanitizers that have had the methanol on, and they've been recalling those. So of course you wouldn't want to use those. And I see a couple hands, so that's some good questions here. Karen, I think, is raising her hand. Is that correct? You want to unmute?
Okay. Can you hear me?
Yeah, I can.
Okay. So as we're standing outside taking the child's temperature, and if we wear a cloth face covering, and obviously we're close enough to them, will we be exposed if they do have a temperature at that point?
Potentially. So if you're within 6 feet of the child.
Okay.
So that's why if you have and even the no touch 6 feet, I mean, most of the time you're closer than that.
Right.
Now you might not have your face 6 feet. I know, depending, I know you can stretch your arm out and that helps, but that's why a barrier, some kind of barrier in front is best. Okay.
So were they contagious 48 hours beforehand, based on what you were saying earlier?
With a positive case, they always look at 48 hours prior to the symptoms. So, because that's what we'd call communicability, that the virus is actually in your body, but you haven't had symptoms just yet. Okay. So we look at that 48 hours prior. Good questions.
Okay. Okay. Thank you.
Sure. Any other? I thought I saw another maybe hand raise, but I could be wrong. Am I good to go, Brenda?
Yeah, I thought
Okay.
I did too, but they must have put their hand down.
Okay. Okay. I was like, I can't see everybody, but I was scrolling through the screen. So, I'm just going to jump to the bleach dilution and the recipe thing. So just to let you know, we are aware that the CDC has kind of what I'd call recipes on the bleach. So if you can't find disinfectants that you normally would use, that's challenging right now, the CDC said you can use a bleach solution. And they say you can use regular household bleach, and then you can dilute it, and they'll give a recipe. And there's actually a couple different versions. I've seen different recipes even that CDC has come out. And I'm just going to be honest with you. I'm in a group of consultants, of coordinators for child care nurse consultants, different states, and we meet usually every other week. And one of our representatives, actually from California, she and one of her colleagues, who is an environmental health director, they actually wrote a request to the CDC to please take the recipes off of the website because it's confusing. I don't know if they will, but at least the formal request went in. The challenge with that is that we know that all the different bleach brands out there have different mixing ratios. It might be 1/3 of a cup to a gallon of water. It might be 1/2 cup to a gallon of water. And that has to do with the concentration of bleach of the product that you're using. And it can range anything from like 5 to 7 to 10% chloride. And so that's why those recipes don't really work, because it's just a general, you mix this together with water, and we really need to follow what the manufacturer says that works, because we want to make sure it's diluted appropriately so that it's actually going to kill the COVID virus. So I would just say, you might see those recipes kind of floating around of what you can mix together for disinfecting with bleach. But what we say is, please refer to the manufacturer instructions, which would be on the label for the specific bleach that you're using. And that might be different every time you buy a new bleach bottle. And I will tell you, that's happened to me. So it's like you buy one brand, and the next time you go out to the store and you're trying to find bleach, you can't find the brand you normally buy, and you end up buying whatever you can get off the shelf. So definitely looking that up. If it's not on the label, it needs to be, you really want to look for that EPA number that's on the bleach bottle. So you can look down, usually it's in like kind of the lower, either left or right-hand corner, you'll see EPA number such and such, and it'll give you a number for that bleach brand. And so that's a really good opportunity to reach out to your local nurse consultant, because they can look it up for you. We look up chemical stuff all the time, and it's a confusing website, and we've You know, you have to go to the Environmental Protection Agency website and look up the actual EPA number. But our nurse consultants are used to doing that. So if you have the EPA number, you can email them or call them and just say, hey, can you look up this bleach and tell me what I'm supposed to dilute it to and then what is the dwell time? That's the other thing too. The recipes sometimes will say, you know, the dwell time is, you know, 2 minutes or 5 minutes or whatever it says. And we really need to follow what's on the manufacturer label for that specific bleach in terms of how long it needs to sit on the surface wet before it will kill that virus. And like I said, it has to do with the percent of the bleach itself. So that's just so you know that that's out there, and just reach out to your nurse consultants if you need any help on that. The next question that's come up is about 70%, using 70% alcohol for disinfecting. So the CDC also put that if you cannot find your disinfectant that you normally use, and you cannot find bleach on the shelf, that you can use 70% alcohol for disinfecting. And I will just say, in the child care environment, that is a huge concern. And the reason that we say that is because 70% alcohol put in a spray bottle, for one thing, not only is it hard to keep it wet for as long as it needs to because it dissipates so fast. Think about how alcohol dries so quickly. But the real concern for the using alcohol for disinfecting is that a child could possibly get exposed to the alcohol. It is if you read any of labels for alcohol, and I looked this up, but it says keep out of reach of children, caution flammable, we know that. The big concern about it can cause really eye irritation, and it's not minimal, it's in the moderate level, and they say do not have any kind of spray that gets into a child's eye or an adult's eye, and that you would need to do a flush. And so that's a real concern that, you know, a child could, and it's really not that they're going to touch the spray bottle. I mean, they could. If you had the bleach spray bottle and it was within reach, I mean, of course that would be a concern for the child, but we're really concerned about that it's on the surface, and if it's wet and then they touch that and then they rub their eye, because you know how kids are. And so then you've got, you know, 70% alcohol that could really cause an eye irritation, potentially a burn. So that's a concern. The Iowa Poison Control is very concerned about using 70% alcohol for disinfecting, because they know that that children, you know, have, you know, they have immature livers. If they were to drink it or somehow get exposed to it, you know, in their mouth, that it really can cause some severe concerns, including drowsiness. It affects their central nervous system, and then they can actually have problems with leading into seizure, coma, and even death from an exposure to that level of alcohol. So they you know, they say if a child is exposed to any alcohol, but definitely 70% is pretty high percentage, but any alcohol, that you need to call poison control. So I would say, you know, the Department of Human Services has actually provided some funding to the child care resource and referral agencies to help provide or to purchase products for disinfecting. And so if you are having a hard time finding your disinfectant, please reach out to your CCR&R consultant to see, you know, and tell them, you know, I'm looking for my disinfectant, I can't get it. I tried to get bleach, I couldn't get that. What do I need to do? And see if they can hopefully get that. And they've been great. We actually had one of the areas I know had some products, and then one of the other CCR&R areas didn't. And I called up, and it just happened. I reached out to your region, and Mary Jansen's like, oh, we can help them out, you know, because I mean, we just want to make sure that providers have what they need. And then the last thing about common questions, I get a lot of questions about outdoor play environments and disinfecting in the outdoor play environments. And we really say for equipment, and the CDC says that using disinfectants outdoors is really not a good use of your disinfectant. Now, the high touch areas, that's one thing. So say you have a picnic table outside, and the kids are doing, you know, maybe some arts and crafts, or they're, you know, they're painting, or they're doing a nature explorer or something fun in the outdoor environment, and they're sitting at a table. Definitely you would be cleaning and disinfecting that before and after that they, you know, use that piece of equipment. If you have a playground structure, any kind of structure, they say that they recommend like the places where they're gonna, what they call handholds, or where the child would be putting their hands. So either on railings or climbing ladders, or maybe on the slides, those areas where the kids are putting their hands. But washing hands after they come in from playing is definitely important, and that can help if there was any potential for exposure in the outdoor area. That washing their hands when they come in is best practice. So I would recommend that. I don't know if you are aware, but the National Program for Playground Safety, which is a great resource for the United States, for many child care programs across the United States. They're actually right here in Iowa at the University of Northern Iowa, so not too far from many of you. And so they have developed some fact sheets and some resources specific for outdoor areas on COVID, and they're the experts. So some really great handouts. And I've talked to Heather Olson there at National Program for Playground Safety, and she's like, oh yeah, have our, they're free. They can download them. They can print them off. We've got a lot of information on our website. So I'm going to send you to the experts for outdoor play environments, for disinfecting, and for COVID questions. The next thing I just want to kind of show you, and this has come up, is that sometimes it's just so challenging to find what you're looking for on the websites, which I completely agree. So I'm actually gonna go live to our website so I can show you, and I'll pull up, I'm gonna stop share for just a second, and then I'm gonna pull up our, let me see here. I'll pull up our Healthy Childcare Iowa website so I can show you that. Okay, hopefully, do you see my website right now? Am I sharing it? Yep, we're good. Brenda's giving me the thumbs up. That's great. So the Iowa Department of Public Health has a Healthy Childcare Iowa website location. And so if you were to go, you can Google Healthy Childcare Iowa, it'll come up that way, or you can put in your search engine www.idph.iowa.gov and then a /HCCI for Healthy Childcare Iowa. So this is our main page. And then we have these tabs over here on the side. So if you haven't been on our site and looked at all our tabs, I would encourage you to do that. If you click on the Child Care Nurse Consultant tab, you'll actually go to where you can click here, Find a Consultant, and it'll bring up a PDF document of a map, and then also the contact information for your local nurse consultant. So if you haven't gone on that, or you're not quite sure, and then on here also is my contact information, phone and email. So if you had a question, and I actually had this happen just this evening at 5 o'clock, a provider could not get a hold of their DHS consultant, and she said, well, I was trying to figure out who to call next, and my local nurse consultant, isn't answering, and of course it's after hours, so I'm sure that's some of it. And just happened that she contacted me, and I was able to I was still working since I was doing this tonight, so I'm like, oh yeah, I'm here, what do you need? And so she had a positive case and didn't know what to do for the next morning. So so my information is on this, as well as we have a TA team. So we have our local nurse consultants, but then we actually have some nurse consultants that kind of cover for our technical assistants. So like right now, I know we have a few nurse consultants in our state right now that are on vacation because it's almost school starting. So a lot of times they'll, and might take a week off for something. So there's always somebody here though that can answer questions. So if if you have a concern, you can always reach out to me, or you can reach out to one of the TA team nurses, and their numbers, their information is right on the front on that, the maps on the front page, and then the second page has our contact information, and then of course your local nurse consultant. So there's a couple other tabs here. Child safety talks about some of the different Consumer Product Safety Commission reports and some information for those. Some information on childcare screen time and physical activity. And then I want to show you this site here. This is where you can go to actually sign up for recalls. So they have a recalls.gov, which is for toys and children's equipment and things like that. So you can sign up for that. That's a great website. And then there's links for the Consumer Product Safety Commission here, the Food and Drug Administration. So that's where you would click to look up if your hand sanitizer possibly has been recalled because it has methanol in it. So that's the link that you would click on, and they actually have that right on the front. And then the National Highway Traffic Safety Administration also has recalls sometimes of car seats or transportation, booster seats and those kinds of things. So that's the link. And you can actually sign up for their listserv, so you'll get an alert when there is a recall. So I would encourage you to do that. And then the last place I want to take you to is the printed products section. So this is where we kind of put all of our handouts and fact sheets and information on this website. And I'm just going to scroll down to, we have an actual COVID section. And this is all of our COVID-19 resources section. And so like the CDC guidance for child care programs that remain open, here's the direct link to that. So you don't have to go searching all on the CDC website. You can go right to our page. The alert about the hand sanitizers with methanol right here on the front page. So if there's something that I feel like it's important, I make sure that our website is up to date and has that information, so you can go right to that if you're looking for information. And then the guidance document about the case reporting and outbreak responsibilities, the DHS IDPH. This is also on the DHS website, but I put it here too, just so that you can download that and read that if you need to. Some information on here, what to do if someone's sick. So that would be the direct link to the form that you would want to post for families, so they have that information about COVID. The cleaning your facility when someone's sick, the link's on here. The Test Iowa link is on here. The quarantine information with those close contact scenarios and the calendar, those are there. And then we have some additional resources, the guidance from Iowa Department of Public Health on the cloth face coverings, and some of the other links are on here, as well as the Centers for Disease Control links. And then definitely Department of Human Services direct link to their website is I put on here just so you can get there quick. And I know you know how to get to CCR&R's website, but just in case, it's on here too. I know we all try to have links on stuff because sometimes when you're on one site, you just want to find what you're looking for. So we try to be collaborating with each other. And then we do still have that guidance document about first aid, CPR, and AED, the course extensions. We know they're still honoring those extensions because of limited access right now for in-person training. So that's coming, but it's not quite there yet. So those course extensions are still on there. So that document's on there. And that's about it that I had. And I know we're almost at the end of time, but I hope that was helpful. And I don't know if we had anything come up.
I don't see any additional questions in the chat box, but we do have a couple of minutes left. So if anybody has a question that they want to ask Heidi, you can unmute yourself or you can type in the chat box. Well, I do not see that anyone.
No, I'm not seeing anything either. So.
Okay.
And you can always reach out if you think of something later. Please just email or give me a call tomorrow or leave me a message. Oh, somebody's raising their hand. Karen, you want to unmute?
Okay. So what if a child has, obviously most kids in the childcare home setting are young.
Mm-hmm.
So they aren't going to have most of the symptoms because they can't voice those symptoms.
Correct.
So the symptoms like, I'm just trying to, like
sore throat, they might not tell you they've lost their sense of smell, right?
Well,
Yeah.
most of it, I mean, from difficulty breathing, I mean, none of those symptoms they can voice typically.
Right. Yeah.
So if they have like the sore throat, the muscle aches, none of those are gonna. But if they have like not like vomiting or it's like if they have 2 or more symptoms that you know of, should we require them to get tested?
Well, we can't require, but this is my general recommendation. Right at this time, our current guidance does not differentiate between symptoms. It's any symptom, and they don't say 2 or more, or they don't say fever, and it's just any of the symptoms on the list, which is a lot of symptoms that are, could be other illnesses, but they're really saying at this time, it could be COVID. So if we definitely want to encourage families. We have testing readily available. If the child has symptoms and they choose to get tested and they test negative, then that they feel that that's a valid negative test result because they actually have current symptoms, but they test negative. Now, if they have no symptoms and they test negative, that doesn't mean that they don't have a positive case. It just means it's not showing up enough virus in their system to pick it up. So that's a different thing. But if they're having symptoms, and I would say, yes, a child might not be able to verbalize some of those symptoms, but if they're having diarrhea, or they've had a fever, or they've had a cough, and that's unusual for the child. And that's the other thing, the kids. So, there's some kids, they have runny noses all the time. So maybe that's their norm and they have seasonal allergies, and you know that, and you have that in documentation, either in a care plan or documented in their health record. We might not be as concerned, but the child that normally is healthy, happy, running, jumping, doing all the things that they normally do, and all of a sudden now they're, you can just, they're not as active. They seem like they have more fatigue. They maybe have a runny nose. That's when you really have to be concerned of, could they have a mild case of COVID and we just don't know it. And so best practice would be to exclude them for that 10-day period unless they go and have a test. And if they test negative, then they could return sooner. So.
Okay.
And that might change. I'm just going to be honest with you. That could change. I know that right now they're really looking at that. The CDC is really looking at those guidance documents because with schools opening, having kids out for 10 days is going to be challenging. So,
Right.
That could change, but I'm just saying as of today.
So, because like I said, I'm trying to write up policies because I had a parent that had a problem with one of my, they had a rash and anyway, and they had to go home and stuff. Anyway, so they want a list of the exclusions. They just want, and of course, like you said, it's hard because it's changing and, et cetera and stuff. So I'm just trying to come up with something that, and, it's so hard to come up with something because everything's changing.
Yeah, it is. I would definitely, if you don't want to actually list the symptoms, you could say the symptoms that the Centers for Disease Control has listed for COVID-19, because then if it changes, you can refer to the current list of symptoms on the website. And that's right on the CDC website. And you click on symptoms and it'll give you the most current list. So that would be a way to kind of work around that a little bit. I know that families are frustrated. It's frustrating. I know it's frustrating. It's frustrating for families. It's frustrating for childcare providers. But it's very frustrating when a child is allowed to be in care that is actually ill, and the parent, maybe says, well, they're fine, they should be able to be in care, and you allow it and don't exclude them, and then they end up becoming positive. What happens is then, a lot of times it affects a lot of families and a lot of children, because now it's not only just, I really feel for, child development home providers, because it not only affects you yourself because now you've been exposed, but it affects your whole family because your business is part of your home environment. So I feel like I understand parents' concerns, and I understand that being out for 10 days or 14 days or whatever they need to be out is challenging. But I would just say overall in your policy, I would put in there right front and center, it is important that you have a backup plan for childcare in the event that your child is exposed in care or your child tests positive. And you should have a backup plan for 14 days. So,
Right.
I mean, they just need to, right, in this time period. I mean, we haven't said that in the past, but that's something we need to really be encouraging families, because they need to have a backup plan, because you might need to exclude their child for 14 days, you know.
And they need to understand that their backup plan can't be another childcare program.
Exactly.
Because
Exactly.
then it's exposing all those kids. So the
Exactly.
backup plan's got to be somebody that they can live with for 2 weeks.
Yeah. Yeah.
I was thinking that, Brenda.
Yeah.
Yeah.
Yeah. I'm glad you said that, because you're right. That's exactly right.
Right.
Don't just think you're gonna, you know, but I mean, you know, think of who they have. Who do they have as neighbors, friends, you know, their cousin. I mean, you know, a lot of colleges, they're not doing in-person learning. Maybe they could be, you know, looking at, they've got a family friend that has a college age student that would be willing to be the backup plan. You know, or they need to be making sure their employer knows that they're going to need to have a backup plan, and they might be out working from home for 14 days with their child. So it's challenging. And that, like I said, you know, I've heard different things being proposed of how we can work around this. I'm not sure that they've come up with any specific things yet of how we're going to get around this right now. We just need to hope for a vaccine.
So what about runny noses and congestion? Because that's on the list.
Oh, I know. That's a challenge. I would say, you know, if you have a child that we have this come up a lot where, you know, you say, well, a child with asthma, I have a child with asthma, and they cough all the time. They're always coughing. So if you have a care plan that is in place for, like, say, a child that has, you know, recurrent, you know, allergies, they take an allergy med, or the child has asthma and allergies, and you have documentation that it's normal for the child to have a runny nose, or it's normal for a child to have a chronic cough. You know, it doesn't mean that they're ill. They're just, you know, that's because they have that disease process. Then I would, you know, then you have, you can talk with the parent about how you would handle if they would have any other symptoms other than those, but those would be kind of the normal for that child, but you would have documentation of it. I've had a couple, I know I had a couple different phone calls where the family said, well, it's allergy season. My kids always have runny noses this time of year. And so I said, well, they should be at the doctor's office and having that in writing for you to have that in your chart, so you know that. So, and they, you know, or I had one parent that actually called me because they were frustrated because the provider said, well, call Heidi. That's who gave me this information. So I talked to the very frustrated parent one night, and I said, well, have you been, they go, well, we give them over-the-counter Zyrtec. And I said, well, then you need to have that in writing from the doctor, you know? And they said, well, yeah, we've never gone to the doctor for it. So, well, if you have it in writing that that's normal for your child, you know, that maybe would be different. But right now we have to exclude them. So it's tough, but we're trying to safeguard your whole business and not just the one family.
Right.
While you were talking, Heidi, we did have one more question come in.
Sure.
That this provider says she has had COVID herself previously. If one of the daycare kids gets it, does she have to quarantine for 14 days?
Well, right now, and I'm saying right now because this could change, but we do not know how long antibodies are present after you've had a positive case yourself, and how long you would have protection. The CDC does not have that data yet. I know that they're looking at that, and that could change, that they might say you would have some natural immunity then, and that would maybe be a different situation. But for right now, what we have is that they do not, they are uncertain about that. Good question.
Okay, well, we're about 10 minutes over, so unless somebody has a real pressing question, we will call it for today. And we were recording this, so it will be posted on our website. And of course, if you have additional questions that come up After this evening, you can reach out to Heidi or directly to your local nurse consultant. If you don't know who your local consultant is, get a hold of your CCR&R consultant. We can help you get that contact information too. And Heidi showed you where it is on the Healthy Childcare Iowa website as well.
Thank you so much for having me tonight. I hope this was helpful, and like I said, reach out if you have any questions. Thanks, Brenda.
Thank you. Thanks.
Have a good night. Stay safe.